Today I'm going to be demonstrating tracheostomy care. I've performed hand hygiene, introduced myself to the patient, and verified the patient using 2 patient identifiers. I've explained the procedure to the patient and answered any questions that they may have and provided for patient privacy. To prepare for suction, if I had a device, I would turn it on now. The negative pressure to suction has been set to less than 150, so at about 145, let's say. To verify that the suction is working, I would occlude the end of the suction tubing before attaching the suction catheter. If indicated, I would increase the supplemental oxygen to 100% or hyperoxygenate as prescribed and encourage the patient to take a few deep breaths. I'm now going to prepare the disposable suction catheter. So using aseptic technique, I'm going to open my sterile catheter packages on a clean surface and use the inside of the wrapping as a sterile field. I have filled this container with some, I will fill this container with some sterile saline. I'm going to leave that container uncapped. And now I'm going to perform hand hygiene and put on sterile gloves. With my dominant hand, I'm going to pick up the suction catheter, and then with my non-dominant hand, I would connect it to the connection device, but again, I don't have one. So now I'm going to insert the catheter into my tracheostomy and perform suctioning. I'm going to use my dominant hand to do this, and I'm going to go in quickly but gently. Oopsie. Quickly but gently until I feel resistance, and then pull back 1 to 2 centimeters. And then I'm going to, using my non-dominant thumb, I would depress the control vent of the suction catheter to apply intermittent suction while completely withdrawing the catheter up to a maximum of 15 seconds. If necessary, this process may be repeated, allowing a minimum of 20 to 30 seconds between attempts. I'm going to wrap this up in one of my gloves and dispose of it this way. Dispose. And now I'm going to care for my, we have a non-disposable inner cannula, so I'm going to prepare for cleaning that. First I'm going to sit her upright, my patient. There she goes. So beautiful. Her name is Sally. I'm going to first need my supply kit. I opened my supply kit already, and then I'm going to put on gloves. Gloves are not cooperating. I'm going to only touch the outer aspect of the tube. I'm going to unlock it and remove the inner cannula of the tracheostomy tube. I'm going to drop it, so boop, unlocked, and I'm going to drop it in my sterile solution to loosen any secretions to make it easier to clean. If I had an oxygen source, I would be placing it over the inner cannula, or excuse me, the outer cannula. I'm going to remove my gloves, perform hand hygiene, and put on another set of sterile gloves. Okay, so now I get to clean the inner cannula. I'm going to pick it up. Again, only touching the outer connecting portion. I'm going to pick it up, and I'm going to use a sterile brush from this kit, this cleaning kit, to clean the inside. Inside is clean. And then I also clean the outside. Then I dispose of that. And I use the same sterile solution as before. And I'm going to pour it over the inner cannula to clean it. Technical difficulties. Ah! Technical difficulties. Alrighty. I think we're good. Technical difficulties. Sorry about that. Okay, so so we clean. I already cleaned out with the with the scrubber, the sterile scrubby, and I disposed of the sterile scrubby. And now I poured this solution, the sterile solution saline, over this and over this basin that I've been working in. And then I poured that with my non-dominant hand, and then I'm going to put the inner cannula back in place using the locking mechanisms. Boop. Perfect. If ordered at this time, I would reapply oxygen, and if needed, I would hyperoxygenate the patient. Now I'm going to remove the drainage sponge. Dispose. And then I'm going to use a gauze, dip that in normal saline, and then I'm going to clean the outer cannula, all this area, and then dispose. And then I'm going to use a cotton-tipped applicator, saline, to clean the stoma. So I have to go, ooh, be careful. Just trying to, patient safety, you know. Clean the stoma and the area under the faceplate. And I'm going to do this in a circular motion from the stoma outward, I suppose. And then I'm going to use some gauze to dry the outer cannula area. Padding dry. Now I'm going to insert a fresh this is a fresh dressing under here. Gotta be careful. Got that on there. And now I'm going to secure this using the tracheostomy tube holder method. You would try to get a partner, and if you can't find a partner, you just maintain a secure hold on the tracheostomy tube by leaving the old ties on for now, and then I'm going to try to place the new ties. Yeah, so I got her propped up. Got my new ties over here. I'm going to take the narrow end of the ties under and through the eyelets of the faceplate. Okay. I'm going to do this very carefully. Okay. Yeah, you gotta be careful. And now I'm gonna remove the old ties again carefully so my new ties don't fall out. This is, you know, MacGyver stuff over here. Gotta be a little careful. Okay, tighten that. Okay, and now you're gonna want to dispose of the old straps, and then you want to make sure there's enough slack you can put at least 2 fingers underneath to make sure that the patient is comfortable. So like 2 fingers fit under there. You want to make sure the patient is comfortable and safe. At this time, you'd ask if they feel comfortable as well. To clean up, I'm gonna put the cap back on this bottle. That I got my normal saline from, and I'm going to date the container, date this, and put that in a acceptable area. I'm going to ensure that my items are stored and disposed of properly. Dispose. Take off my gloves. Perform hand hygiene. Document the procedure in the patient's chart.